Hello, my name is Carl Tabor. I've had knee pain for probably the last 8-9 years, and my PCP told me to go see a physician and have knee surgery, and I came to Dr. Jeff and he straightened out my knees, and they haven't been bothering me now for the last 3 weeks.
If you watch this video, then you or someone you know or love is suffering from knee pain. And for many of you, my office just may be the place to help your knee or knees start the healing process. And that's because I've been trained in a super effective way to help heal chronic knees. You're probably trying to avoid going under the knife or having surgery. I know I would be if I was in your situation. And you may even be contemplating buying stock in Advil or Motrin. What are all those pills doing to your insides? You're probably frustrated. But what are you supposed to do? Because up to this point you've been given no other real options except to mask the pain with drugs or have risky surgery. I have saved countless people from having surgery on their knees. But please keep in mind, this is not a cure for all types of knee pain. If you have an acute injury where there is a tear, this is not a treatment for you. Basically, this treatment works best on old beat-up knees, not young knees. I know this is counterintuitive, but that's the way it works. I've worked on hundreds of knees, and I've seen this technique work better on older, achy, chronic knees. So how do I tell if I can help you? By performing a thorough exam of the knee. So let's see how I actually perform this incredibly simple adjustment on the knee. So everybody wants to know how we treat knees as a chiropractor. Well, what we want to do is work on a part of the knee that consists of what are called proprioceptive areas in your body. They're called Golgi tendon organs. And these areas, they kind of perceive where muscles and tendons and joints and ligaments, where the pressure is on them. And as you've damaged your knees over the years, the Golgi tendon organs kind of don't know what to do. So they're kind of mixed up. And what we do is we put pressure on each knee in a certain way. I'm going to show you here in a second. In the same way that if your computer had the wrong information or too much information on it, you reboot it, you restart it. And that's what we do with the knee. And it seems very simple, and it is simple, but the results are amazing. So if you don't have an active tear in your knee, if you have generally achy knees with occasional sharp pain, you've had it for years, chronic knees, those are the type of people that get really good results. If you go and tear your knee, go see a physical therapist. But if you have chronic knee pain, this is what we do in our office. And it takes some time. But if you want to go in a little bit closer here, what I do is I contact an area where the Golgi tendon organ is, and I put 60 pounds of force over that area, and then I flick it. And then we do the same thing with the other knee, and we flick it. In doing that, it resets, or reboots the computer, so to speak. That Golgi tendon organ now knows when to fire to balance out the knee when you put pressure on it. So almost 90% of the people, when they get off this table and stand on that knee, they'll go, wow. They'll notice a huge difference. That's why we call it the miracle knee adjustment. Out of all the different adjustments I do, this one is the #1 adjustment that can take you from a lot of pain to no pain very, very quickly.
My name is Joy Carl, and I live in York, Maine.
So, Joy, you had knee pain for how long? Just maybe tell me a little bit about it.
A good month, 6 weeks. I had knee pain, and I exercised a lot, and I was worried that I had torn something.
Okay.
And I did get an x-ray that showed nothing and no arthritis. Then Dr. Jeff said, I can do knees, and he worked on my knee, and I have no pain anymore.
So you basically were thinking you might have had to have surgery, and you're not having it now.
Absolutely. I thought it was torn. Everybody said they had the same thing. They had to go get it fixed, surgically. And I just had it adjusted. I think I was doing a couple times a week at first.
Yep.
Now I'm down to once a month, but it's totally gone. Both knees are great.
All right, so you're happy with it?
Happy, happy.
Okay, thank you.
You're welcome.